Okay, my name is Misha Adriano, and I'm going to begin my head to toe physical assessment. I've already done the subjective part, so we're going to move right into the physical part. So I am looking at the patient, and the patient appears to be in no acute distress. He is alert and oriented times three. He is well groomed and neat. Now we're going to move on to his skin. His skin is intact, no abnormalities noted, no pallor noted, no cyanosis. And his skin color is appropriate for his ethnicity, and his skin is also warm. Okay, so now I'm going to move on into the head. So I'm looking at his head. His head is atraumatic, normal cephalic, and it's also symmetric. I am now going to palpate his head. So now I'm going to feel your head. Let me know if you feel any tenderness.
No.
So his head is non-tender, and I also did not feel any lumps. And his hair is evenly, is appropriately distributed. Okay, now I'm going to move into the face. Can you raise your eyebrows for me? Okay. Can you smile? Can you blow your cheeks? And then show your teeth? Okay, so cranial nerve 7 is intact. So now I'm going to palpate his TMJ. Can you open your mouth and close? So I feel no clicking or anything with the TMJ, and his cranial nerve 5 is intact. Okay, that concludes the facial portion. Now I'm going to move on to his nose. I am looking at his nose. His nose is intact. There's no abnormalities noted, and is also midline. So now I'm going to take a look inside of his nose. Okay, lift up here. Thank you. So we see pink mucosa, pink and moist, no drainage, no exudates noted, and the septum is midline. We're going to test the patency of the nares. Okay, I want you to take breath in that nostril and take a breath in that nostril. So the nares are patent. Okay, now we're going to move on to the ears. Looking at the ears, they are intact, and no abnormalities are noted. Okay, so I'm now going to palpate the mastoid process. You let me know if you feel any tenderness. So I am palpating his mastoid process. Any tenderness, pain?
No.
Okay, no tenderness or pain. So we're going to move on to the other portion of the ears. I'm going to take a look at the ears, and I'm going to look inside. Like I said before, the external ears look intact, so I'm going to look inside of the ear. So the canal is clear, and I am able to visualize the tympanic membrane. It is intact, and appropriate landmarks are noted. I'm going to look at the next ear. Looking in the ear, the ear canal is clear, tympanic membrane is noted, and appropriate landmarks are noted as well. And the tympanic membrane is intact. Okay, so we're going to move on to going to palpate his lymph nodes, and he's going to tell me if he feels any tenderness, and I'm going to see if they are enlarged at all. So I'm going to the preauricular, the postauricular, the tonsillar, the submandibular, the anterior cervical, and the posterior cervical. So no lymphadenopathy is noted. Did you feel any pain or?
No.
Okay. So next up, we're going to assess cranial nerve 11. Lift your shoulders for me. Now, cranial nerve 11 is intact. And now we're going to look at the neck. So I'm looking at the neck. The trachea is midline. I see no jugular vein distension. So now I'm going to take a listen to his carotid arteries. Okay, I listened to both carotid arteries, and no bruit is noted in the carotid arteries. And, or he said jugular vein is not distended. So now I'm going to palpate his thyroid. So I'm going to turn around in here. I'm going to just feel for your thyroid here. So I am palpating his thyroid. His thyroid is soft and non-tender. And then also going to palpate your sinuses. So I'm going to palpate the frontal sinus. Do you feel any tenderness?
No.
And then I'm going to palpate the maxillary sinus. Do you feel any tenderness?
No.
Okay, perfect. So we are going to move on to the cardiac portion of the exam. So I'm going to listen. I'm going to listen to his heart sounds. I'm using the bell of my stethoscope. So I'm going to be listening to aortic, pulmonic, tricuspid, and mitral. And S1 and S2 were present in the heart sounds, and I heard no murmur. Now I'm going to palpate for the PMI, which is located left sternal border, mid clavicular line. So I'm going to count down. Sternal border, 1. Then mid clavicular line. And this is where the PMI is located. Excuse me. So now we're going to move on to the lung sounds. So in the lung portion of the exam, so I'm looking at the lungs, the chest, and the chest is symmetrical. I see no labored breathing with this patient. So now I'm going to listen to his lung sounds. Okay, so just take a deep breath in whenever I move or whenever I say take a breath. 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 Okay. So lung sounds are clear bilaterally. And then now I'm going to percuss the lung fields. Okay, so the lung fields are tympanic throughout. And then now I am going to test for tactile fremitus. So what I'm going to do is put my hands like this, and then every time I move them, you say 99, okay? Ready?
99, 99, 99, 99.
Okay. Tactile fremitus is present throughout. So now I'm going to move to the posterior portion. So I'm going to do the same thing. I'm going to listen to his, turn a little bit this way. Oh, just like that. Yeah. I'm going to listen to his lung sounds. All right. Deep breath. Deep breath. Deep breath. All right, listen to his lung sounds, and they are clear bilaterally. So now I'm going to move on to the percussion portion. So I'm going to percuss throughout the lung fields. And the lung fields are tympanic throughout. So now I'm going to do the same thing again with tactile fremitus. So when I move my hands and say 99, you say 99, okay, every time I move.
99, 99, 99, 99, 99.
Okay, and tactile fremitus is present throughout. Now I'm going to test for CVA tenderness. So for you, I'm going to put my hand on your back and gut it lightly. And if you feel any tenderness, let me know.
No. No.
Okay, so we have done CVA tenderness, and that he didn't feel anything, so CVA tenderness is negative. So now we're going to move on to the abdomen portion. So if you don't mind, please lie on your back. Let's adjust the camera here. Okay, perfect. So now we are going to begin the abdomen portion of the exam. So I'm looking at his abdomen, and his abdomen is flat. No distension is noted. So now we're going to move on to the auscultation portion of the exam. So now I'm going to auscultate all 4 quadrants of his abdomen. And vowel sounds are present in all 4 of the quadrants. Now I'm going to go to the percussion section of the exam. So I'm just going to percuss throughout his abdomen. And his abdomen is tympanic throughout. Now I'm going to start with light palpation and then deep palpation. Now I'm going to palpate for the liver. Take a deep breath, please, and hold it. Liver is palpable right down here. Okay, exhale. Now I'm going to palpate the spleen. Spleen is not palpable. Now I'm going to palpate the left kidney. Left kidney is not palpable. Now I'm going to palpate the right. And right kidney is not palpable. Okay, you can sit down. Okay, now we're going to move on to the cardiovascular portion of the exam. So I'm going to take a look at your hand, and we're going to do capillary refill. And his capillary refill is less than 2 seconds. There is no clubbing noted of his fingers or nails. Same thing with this hand. Capillary refill is less than 2 seconds. No clubbing is noted in his hands or nails. Okay, now I am going to assess the different pulse points. So we are going to do the carotid, +2, both symmetrically, bilaterally on the carotid. Then we are going to do a brachial, +2 symmetrically, bilaterally, with the brachial. Then we're going to do the radial, +2 bilaterally with the radial. Now we are going to do the, yeah, please take off your socks, thank you. We're going to do the dorsal pitalis, +2, and the pedalis tibialis, posterior tibialis, +2. We'll do the next leg too. Dorsopedalis, +2. Posterior tibialis, +2. Okay. And now we are going to do reflexes. We're going to do the tricep reflex first. +2. Brachial reflex. But not brachial, bicep reflex. +2. Brachioradialis. +2. Same with this side, triceps. +2. Bicep. +2. Brachioradialis. +2. And then can you go to the chairs for the patellar, please? And then we're going to do the patellar reflexes. Patellar, +2. Patellar, +2. All right, you can sit back down. So we've done the reflexes, we've done the pulse points. Okay, so now we're going to do sensation. So I'm going to do sharp or dull. So you're going to let me know, you're going to have your eyes closed, and then you're going to let me know if you feel sharp or dull. So that this is sharp and this is dull. Okay, close your eyes.
Sharp. Dull. Dull. Sharp. Dull. Dull. Dull.
Okay, all sensations are intact. Okay, now we're going to have you stand up. I want you to walk from here to there. Now walk back. And this patient has normal gait. So now we're going to test, next test we're going to do is the Romberg test. So what I'm going to have you do is close your eyes and put your arms out on your sides. Either way, yeah. So we're trying to see if we see any swaying. And we would watch for a minute and we would say no swaying. So it would be Romberg negative. Okay, you're done. And then now I want you to face this way so we can look at your spine. And then I want you to bend over. And we are looking at his spine. His spine is normal and intact. And there is no curvature of the spine, showing that there is no scoliosis present. Okay. Now we're going to do some range of motion. Continue standing. So I want you to put your arms out, then to the side, up, then back down, cross over. Okay, good. And then uncross your arms. So now we're going to test the strength, and range of motion is intact. Oh, and then stick your leg forward, out. Okay, forward, out. This way, out. Yes, this way, out. Okay, range of motion is intact to all 4 extremities. Okay, now we are going to test strength. So hold your arms out. Now push against my arm. Perfect. Pull against my arm. Perfect. So +5 with the strength. Okay, so now we're going to sit down. And we're going to do the same thing. Let's just do with your leg. So lift your leg up and then push. Okay, and then pull. +5. Push. Pull. Perfect. Okay, and then the final test we're going to do is the Tinel's test. So I'm going to take your wrist and I'm going to tap the median nerve, and then you let me know if you feel any sensation, pain, anything like that, or tingling.
No.
Okay, you felt no pain or sense. Do you have any other concerns or at this time?
No.
Okay. All right, that concludes our test. Thank you.